I'm Marta Waller. I'm here with Dr. Kerry Assil, world-renowned eye surgeon. We wanted to know how to choose a LASIK center and a LASIK surgeon.
It's hard to know what should be the very first question to ask because every person's needs are somewhat different and every person's concerns are slightly different. As far as trying to determine if a center is reputable, I think the internet helps to a certain degree. However, the internet has some good information and a little bit of misinformation and disinformation as well. So what patients should look for is, first and foremost, don't reject your gut instinct. Just because the procedure is being offered at a low price, make sure, just like in the example of a car, to also look under the hood. Don't be mesmerized by price recommendations. We live in a society where prices are set in a fairly competitive fashion. So if somebody's offering a procedure, a medical procedure, at a drastically reduced price, unless if it's for some reason being subsidized by some third party, you can rest assured that there's a lot of corners probably being cut. At our own center, we've never had a patient who's lost their vision due to these procedures that we perform, and the reason for that is that we don't cut any corners. So as a patient trying to get a sense for whether everything is being done properly, I think one question that the patient should ask themselves, they should ask themselves some questions in addition to the staff and the doctor. They should ask themselves, does everybody here seem to be highly professional and well trained? Are my questions being properly answered in a way that makes sense to me? Does the technology and the equipment appear to be up to date, and are the doctors and staff comfortable addressing whether the technology is modern and FDA approved? Can they explain to me why their technology might be better than average and why it might be technology that's reasonable for treatment on my eyes? Can they explain to me what my specific ocular conditions are and how they plan on addressing those? Can they tell me whether there's anything about my eyes that's a little bit, even a little bit unusual, that they'll be looking to customize and focus upon? What is the reputation of the doctor? Who referred me to this doctor? Was it a knowledgeable individual, somebody that I know and trust? Or did I just read about it in the newspaper somewhere? And I think those are probably pretty good basic things to look into. Another thing that I think they should ask the doctor is, how comfortable is that doctor treating unforeseen events? I shared earlier that I've never had a patient who's lost any vision, and part of the reason for that is that my original training is as a corneal transplant surgeon. I was a professor at a university for quite some time, and I specialized in corneal transplantation. So everything about the biomechanics of the cornea, the physiology of the cornea, the optical properties of the cornea are second nature to me. So if I see a patient whose healing is not going along the path that I would expect, I'll typically have simple insights into what I need to do to get them to where they want to go and have them end up with happy vision. So patients should also ask, what are the most typical complications, not just necessarily the worst, but the few most typical complications, and how does that doctor consider themselves to be most skilled in treating them? And not necessarily asking both questions simultaneously, perhaps sequentially. A, what are the most typical complications that arise? And after they've heard the answers to that, ask, how would you go about addressing those if they should occur in my eyes?
I think that pretty much wraps it up and gives us some very good insight into the best way to find the best LASIK surgeon, who is sitting here, but you can't do everyone's eyes, but maybe almost everyone's. And we thank you for this little bit of insight. And until next time, I'm Marta Waller, you're Dr. Assil, and we'll see you next time.